Welcome back, everybody. Thank you guys so much for joining us. We really do appreciate it. Please hit that like and subscribe button and leave us a comment. We want to hear from you. I'm your host, plastic surgeon Dr. Bruce Hermann. With me always is the wonderful Sarah.
Hi.
In her awesome shirt, which I love, by the way, with your fall colors. Spectacular. In the box, Travis. What's up, man? How you doing today?
I'm good. How about you?
Good. It's a happy Friday.
Yeah.
It's always a good day we're on the show because it's Friday.
It's Friday the 13th, too.
Oh, I know, right? Are you guys superstitious at all?
Kind of, sort of.
Really?
Yeah, I can say that. Kind of, sort of.
Yeah, I'm not superstitious. I'm a little stitious.
Me too. I'll believe it when I see it, but it's fun to think it is.
Yeah, I know. It is kind of fun. So, I actually forgot that it was Friday the 13th.
Yeah, there's at Legacy West or East or wherever, there's like a Halloween
is there?
bar crawl.
Oh, bar crawl. You know I'm a fan of a good bar crawl.
I know, that's you were like, let's
That's how
go
we
to
met.
this. Yeah. So it
Nice.
looks fun.
Are you going to go?
I don't know.
Maybe.
I sent it to our friends, our beer friends.
Oh, you did? Did they respond?
I don't know yet.
You know, we were actually looking for something to do tonight. We'll have to talk after this.
Yeah, I know.
Travis, bar crawl, you ready, buddy?
Let's do it.
Oh, really?
Even though I don't drink, let's do it.
Oh, you don't drink? I did
get-
not know that about you,
I'm
Travis.
so square when it comes to that type of stuff, bro.
Really?
Like, I drink like a Sprite. I go to the bar.
Good. So then you can take care of me.
You could drink like a fake beer. I have a friend that drinks a lot of those near beer,
beers?
fake beers.
Oh,
yeah.
really? I
Yeah,
didn't know
just
that.
so you can act
Travis
like.
is like, I'll have a lemonade.
Yeah.
Thanks.
Now, Sarah, didn't you go on some big camp out last week?
I did. I
Good.
took Avery camping.
To
Sam Houston National Forest.
which is in Texas?
Yes.
Oh, okay.
It's near Huntsville.
Oh, okay, Huntsville. How was it?
It was really fun. It was a pretty simple trip. It was just like one night.
Oh, one night, okay.
I actually got to take her cousin, which is obviously my niece, so it was really nice. So.
Fun.
Yeah.
Did you guys, you were in the sleeping bags under the stars, right? Or do you have 10 or how?
I have a tent on
you
top
do.
of my car.
Oh, that's right. I always forget that.
Yeah, so they were all excited. They were like, it's
Aw.
like we're in a tree house. And I was like, kind of.
That's so cool.
So we just went on a couple of hikes. It was really funny.
Fun stuff.
They're like, so what are we going to do? I was like, we're going to go for a walk.
Yeah.
And they're like,
do outside stuff.
oh, okay. And so we were like, they were just walking, and they probably have never walked that much, like,
Right. They're
consecutively.
like worn out.
But they didn't know. They just thought it was like fun. I was like, yeah, this is why
Aw.
things like this exist.
That's so cool. Those are good memories.
Yeah, they had fun.
I am actually leaving next weekend, doing a motorcycle trip to Arkansas. And I'm thinking about taking my daughter. She really wants to go. I've taken her on trips before, but I don't know. It's with like my motorcycle gang that I'm in. They're not really a gang. It's just old guys. But yeah, I don't know. I may take her. I'm still like on the fence about it. She really wants to go. And
Guys trip versus.
yeah, I mean they're all like older, so it's not like a guys trip where everybody's
Yeah.
like out drinking and partying. Like we
What's
have
that?
dinner.
What's that show about? Boss hogs or something?
Oh, I know what you're talking about. Wild Hogs?
Yes.
Wild Hogs. It's like that, but older. It's like geriatric Wild Hog. I'm like the youngest guy by like quite a bit, so.
Oh, okay.
Well, I'll have to take some pictures, but it should be good. So.
I'm going camping again.
I know,
next
yeah.
weekend, too.
I know. Awesome. I want to hear all about it. We'll have stories to tell when we get back.
know.
Excellent. All right, so guys, that October is Breast Cancer Awareness Month. Mm-hmm. Yeah, I almost forgot, because I was getting up segments, like, oh my gosh, it's Breast Cancer
Yeah,
Awareness.
tomorrow I'm doing like a breast cancer awareness workout at my CrossFit
Are you?
gym.
Excellent.
Yeah.
Well, that's
So
great.
we all wear pink and stuff.
Nice. Well, I actually have a lot of experience with breast cancer. And before plastic surgery, I was in general surgery where we treated the cancer patients. And then, of course, once I got into plastics, for many, many years, I did lots and lots of breast reconstruction surgeries. So I have a pretty good experience with these patients. And I try to keep up to speed on it because I still do a little bit of that. So I just kind of want to go over some of the new data on this because, the one thing I would say about breast cancer that's probably like the biggest take home I could tell people is that if you detect it early, it's absolutely curable. And I know this just from the data and from my experience treating hundreds and hundreds of patients. So as of all things, like knowledge is power. Mm-hmm. So I just want to come over some of the stats. And every time I read them, it's kind of surprising. So every year there's 300,000 new cases of breast cancer diagnosed. That's pretty crazy. That's a pretty big number. And that's just the United States. That's not worldwide. Right. In that, every year there's actually 44,000 deaths, which is the second leading cause of death in women behind heart disease.
Yeah, it's a big deal.
It's a huge number. The average age of diagnosis, 62, so it definitely is a disease
My grandma was diagnosed around that time.
In the 60s?
Probably 70s.
Yeah, that's important to know as a woman if you have family members that have breast cancer when they were diagnosed, because younger diagnoses are generally more concerning, and it kind of plays into when you should start to do precautionary screenings and stuff. Breast cancer under the age of 45 years old is very rare, with the one exception being BRCA, which is that breast cancer that comes from the gene issue, and we'll talk about that. Lifetime risk for breast cancer for women, 13%, 1 in 8. So it's a pretty big thing. I've heard a stat that like pretty much everyone in the United States knows or has a family member that's had breast cancer.
Yeah.
Not quite everyone, but pretty close. So when we talk about breast cancer, it's good to know like the different types of it, and it could get confusing really quickly about this. So I'm just going to kind of do some broad strokes. When they talk about in situ versus invasive, that is talking about whether or not the cancer is just very, very like brand new versus it's actually starting to spread in its location, not like all throughout the body. So you'll hear the words in situ, which is really, really good. That means it's super early. Or invasive, that's kind of the more common one because that's usually when you can pick it up a little bit easier.
Right.
Then they talk about the different subtypes. So you'll hear the words ductal, which is the most common type of breast cancer, lobular, and then the more rare one's inflammatory. And I have a little graphic, which actually is kind of interesting to see. It's just a little drawing of the breast. And so when you hear about things like ductal, so if you look at the one on the right, you'll see nipple areola and then ducts. And so the ducts are basically the channels that go from the milk globules out to the nipple. So when you hear of ductal breast cancer, that is a cancer in the cells that line those ducts versus lobular cancer, which actually pops up in the lobules themselves.
Okay.
And so it's kind of, just interesting to kind of see it as a visual graphic, because I can say these words ductal and lobule, and to a lot of people that's just, black box words. But seeing a picture actually kind of makes it a little bit more easier to kind of digest. Other things you'll hear about breast cancer is you'll hear the word triple negative thrown around. So when they take out a breast cancer, they always will run some tests on it to see what kind of markers there are in it, which will determine how aggressive it is. So triple negative is bad, and that means it's negative for estrogen receptors, progesterone receptors, and negative for creation of HER2, which is protein. Now, don't get too in the weeds of this. All it means is when those things are negative, the prognosis is worse.
Okay.
So triple negative is something that you don't want to have. And of note, and we'll talk a little bit about this in a second when it comes to risk factors. Actually, African Americans have a higher rate of triple negative cancers, which is something genetic. It's not like a huge number. I think the average rate for triple negatives is like 15% across the board, but African American women, it's actually around 20%.
That's interesting that whenever they are describing like if it is dangerous, they call it negative whenever something's tested.
Oh my God.
Usually it's positive.
It gets so confusing, right? And have you ever seen those
Yeah.
shows where like the comedy shows where like they say, oh, your biopsy was negative. And they're like, oh my God, that's so bad. And they're like, no, that's good.
Yeah.
So negative is good in a lot of connotations,
Yeah.
but in this connotation, it's actually bad.
Yeah.
So yeah, that is kind of funny. Risk factors, so obviously being female, there is male breast cancer. It's
Yeah.
much, much less prevalent, but there is male breast cancer. But of course, female, increasing age,
Yes.
as we get older, the risk of breast cancer gets higher. Certain genes, and we'll talk just briefly about BRCA. I think I have like a little thing I'm gonna say. Have you ever heard the word BRCA? BRCA?
It sounds familiar.
Yeah, we'll go over it. Family history, of course, is important. If you have family members that have breast cancer, then you're more at risk. Personal history, if you have breast cancer on one side and you decide not to do mastectomies and you still have breast tissue, your risk of getting a second cancer is higher than the average. Race, actually, Caucasian women have the highest rate of breast cancer. I think Caucasians the highest, then Hispanics, Asians, Native Americans are kind of in the middle. African Americans have a lower rate overall of breast
Yeah.
cancer, but they tend to have worse breast cancers. So
Okay.
it's just good to know these things. Oddly enough, taller people have a higher rate, and this is not a huge difference, but it is a little
Well,
bit.
I guess I'm a little sick.
You're good. Yeah, you're good. Denser breast tissue. So obviously breasts can be, more fatty or more dense, which is fibrous. Dense breast tissue is a little bit higher. When you have your menstrual cycles, if you have your first menstrual cycle early versus late, it's a higher risk. And also when you go through menopause, if you have a later menopause, then it's a higher risk. And then there's the factors. So those are all factors you can't really control, right? You can't control what race you are. You can't control how tall you are or, how
Yeah.
old you are. But there are factors that you can control. And I didn't know this one. Actually, heavy alcohol use has a pretty significant increase in the risk. So if you're a woman and you drink multiple drinks of alcohol every day, then your risk of breast cancer goes up about 20% versus someone who doesn't. That's pretty significant. Obese, but only if you're obese after menopause. Like, they've broken this down into just crazy statistics. So if you're obese before menopause, it doesn't really increase your risk of breast cancer, but after menopause it does.
Okay.
Not 100% sure why that one is, although I probably should know. I could look it up. A sedentary lifestyle. So if you work out a lot, that's protective.
Yes.
So you can control that. That's good.
I'm like, I don't know about the check mark on the drinking. I'm just kidding. I don't drink that much.
We'll put a pin on that when we come back to it. If you don't have kids, actually having pregnancies decreases your risk of breast cancer.
Breastfeeding.
That's exactly right, Sarah. Look at you. Gold star today. Oral contraceptives are kind of a question mark. Some studies say that they give you a slightly increased risk if you take birth control. Others say it's not as big of a deal. And then smoking.
Yes.
I'd always heard that smoking it does increase your risk of cancer, for sure, and heart disease and a lot of other things. But specific to breast cancer, it's a little bit of a question mark. So as I was saying earlier, if the biggest take home with breast cancer is that it is very curable when you get it early, and in order to catch it early, screening is very, very important.
Yeah, so go to your OBGYN once a year and they'll fill you up a little bit. But
So that's actually interesting you say that. So we'll actually go to that one first. So breast exams.
Yeah.
So I always heard, in I'd say a little bit more distant past, that breast exams are so important, so important, so important. So now, after decades of research, they actually have found that selective breast exams don't really improve outcomes or increase the detection of early cancers. The thing is that you want to catch breast cancers early, and generally by the time you can feel it, that's not good. That means it's more advanced. Of course, and I was pulling this from the American Cancer Society. Although they don't necessarily recommend that people do routine breast exams, which was a thing when I actually started medicine, that was like really common in the doctor's office. They don't necessarily recommend that anymore. Routine breast exams by your personal ones, they say that that's not necessarily recommended anymore, but they always say that it's not a bad idea. So they say that the research shows it doesn't change a whole lot, but it's still a good idea to do it. But the big one is mammograms.
Okay.
Mammograms are very, very, very good at picking up cancers and picking it up very, very early. So the obvious question is, when do you start? So the current recommendations are that if you're between 40 and 44 years old, that it's optional. Meaning, if you want to go get it done, they'll let you do it, but it's not an absolute necessity. At age 45 is when you should start your annual mammograms.
I'll definitely opt to doing it at 40.
Yeah, because
my grandma had
right.
it, so.
Now, this is for a person of average risk.
Yeah. If
you're high risk, so say for example, like you have family members that have BRCA positive, or you're BRCA positive yourself. Usually if you have family members that are known to be BRCA positive, you get tested because you want to know if you have that, and we'll talk about BRCA in a minute, but it's not good. If you're high risk, meaning maybe you have a fair number of family members that have it, then the recommendation is to actually start at 30 years old and to get a breast MRI and a mammogram annually. So that's pretty aggressive as far as the screening. Now, we've been talking about BRCA. So BRCA1 and 2 are actually genes in our body, and the genes actually repair damaged DNA. So when you're said to be BRCA positive, what it means is that your repair genes, which fix your DNA, don't function correctly. And so that's obviously a bad thing, because cancer generally arises when there's some sort of issue or error in your DNA code. Yeah. And so when those genes aren't working, bad things happen. And I can't stress enough how important that is. I mean, having done breast reconstruction for many, many years, all of like the worst outcomes I can remember, like with patients, almost all of them were BRCA positive. The cancers tend to be much, much more aggressive, and they tend to hit much, much earlier. And it's not uncommon for women in their 30s to get diagnosed with breast cancer if they're BRCA positive. So what do you do? Well, it's a lot of like knowing your family history. If you have family members that got breast cancer super early, then
that's like a good sign.
It could be. If you have, like, say you have a grandmother and a mom who got breast cancer at 35, you should absolutely go get tested for BRCA. Because if you have it, your chance of getting cancer by the time you're 80 is 70%. It's not 100%, but it's pretty close.
I wonder if Ancestry DNA tells you that stuff.
That's a good question. I don't know if they actually look at that kind of stuff.
Yeah, because like they tell you all kinds of stuff. They like told me that I had the sprinter gene, which is like you're genetically like
Really?
more prone to be
A sprinter?
athletic.
Really?
Yeah.
Which turned out to be true.
Yeah.
Interesting. That's a great question. I don't know the answer to, but I think I may have to go look that up.
Yeah.
Interesting.
Let me ask you this, Dr. Herman.
You got it. What's up, Charles?
So my mom had breast cancer.
Okay.
As a man, since it's not as common in men to get it, these statistics, do they still are they still like accurate for like males?
For men, no, man. Breast cancer is so rare in men that there's not generally a recommended screening for it. Like, if for example, if your dad or your brother got breast cancer, I would probably go and talk to somebody and say, hey, what is the proper screening? Which I don't personally even know because it's just that rare. I've never actually, knock on wood, met anybody that's had male breast cancer.
I get you.
And that'd be something I might see just, through all the doctors that I work with that do treat cancer. But yeah, it's pretty rare. So like if, for example, my mom had breast cancer, I probably wouldn't be, super concerned about myself getting it.
Yeah.
Now, if she was like BRCA positive or something, then I might worry about, did I pass that on to my daughter or something?
Yeah.
But yeah, Travis, I wouldn't stress too much about that.
Makes sense.
If she had gotten it super early, then it might be worth, investigating. But if she got a kind of normal stage in life, I don't think that you have to worry too much.
Makes sense.
Yeah.
I got you.
So moving on to treatment, and we could talk for an hour just on the treatment of breast cancer alone. So I'm going to kind of put this in a nutshell. The two kind of basic thought processes for treating breast cancer is you take out a lump of breast tissue.
Okay.
So you don't take out the whole breast, but you take out a lump. If you do that, though, you have to get radiation. So it's called a lumpectomy plus radiation, versus doing a mastectomy, which is taking out the whole breast. Now, it gets really kind of convoluted after that because if you're going to do a mastectomy, do you do one? Do you do both? Sometimes when you get a mastectomy, if the diagnosis is not necessarily favorable, they'll end up doing radiation anyway. Then there's a lot of adjuvant therapies like chemotherapy, which you hear about all the time, hormone therapy, immunotherapy, and targeted drug therapy. It gets very complicated very quickly. But the kind of the take home like for a patient is like, okay, am I going to get a lumpectomy where they save most of my breast, but then I'm gonna have to get radiation for sure, or do I go for the mastectomy?
Yeah.
And all the data shows, at least the last time I did a deep dive in it, that those two options are pretty comparable. It's funny, like having been in medicine now for like a couple decades, I've seen the trends change. Like for a while, everyone was getting a lumpectomy, then everyone's getting a mastectomy, and then it's back to lumpectomy. And so, talking to your cancer surgeon is the best way to kind of figure that out for each individual patient, get the pros and cons. So
yeah, my grandma did mastectomy, but I was so young, I don't know what
the
if
details
she did
about it.
anything else
Yeah.
with it.
Finally, well, not finally, but kind of moving on, prognosis. As I said, if you pick these things up early, it is absolutely curable, and most people go on to live full lives. The kind of latest breakdown, the way they break it down is if it's localized, which means it's just right in the breast, it hasn't gone anywhere even in around the breast like lymph nodes, 5-year survival rate, 99%. You pick it up early, the 5-year survival rate is 99%. That's really good odds. Regional means that if it gets to like a lymph node or to further reaches out in your breast, starts to drop, 5-year survival rate, 86%. So it goes down a little bit. If it's distant, meaning you catch it really, really late so that there's actually cancer spread out, 5-year survival rate, 30%. So those statistics just reinforce the fact that if
Early.
you want to catch breast cancer early. It's so important. Lastly, my part, reconstruction. Just know that when it comes from the reconstruction standpoint, and like I said, we could do a whole hour about that, there are methods out there, and I've done these myself. I have actually a book in my office of women that have had complete mastectomies and have reconstructions that look like breast augmentations. The technology has gotten really, really, really good. And so there's a lot of different options out there. As I've said on previous shows, I'm not a fan of the DEEP flap, which is kind of like the thing that got popular for a while, though now it's starting to get less popular. I usually do the expander to implants. There are times when flaps are better, like patients who are a little bit heavier. But all of that being...
I think you did a segment on that before, right?
Yeah.
Okay.
Yeah, we've talked about that. All that being said, in the past, like so when I started, over 20 years ago, reconstruction was not great. You just kind of got something so that people could wear a bra and not look, deformed. Nowadays, it's completely different. I mean, you get reconstructions that look cosmetic. So, anyway,
That's
but yeah, take home on this. Just be knowledgeable about breast cancer, what the risk factors are, and get your screenings. It is so important.